Today we're talking teeth here on Your Money, how to keep your teeth healthy and clean and not break the bank. We're breaking down tips and advice to help you save some money, how to use a health savings account to pay your dental bills, plus the importance of prevention, how annual cleanings can save you thousands of dollars down the road, and how to save money on dental care in retirement. It's all coming up right here on Your Money. Welcome to Your Money. I'm Gordon Severson, here to help you save, spend, and invest your money wisely. And today we're talking teeth. Going to the dentist can not only be a hassle, it can also be expensive. But if you don't regularly take care of your teeth, those expenses can pile on quickly. That's why today we're giving you the tips and advice to save you some money. Studies have shown that annual checkups and cleanings can save you a lot of money and even bigger problems down the road. The Mayo Clinic recently partnered with dentists from Arkansas to survey residents about their dental habits. They discovered people who have an employer dental plan and stay up to date with cleanings were more likely to save hundreds or even thousands of dollars by preventing mouth disease before it created even bigger problems in their body.
The way that people stay healthier is that by having dental cleanings regularly, it reduces the amount of bacteria and inflammation and infection in the mouth and therefore in the whole body.
I'm a big fan of health savings accounts. They are a great way to pay for medical bills and to save money on taxes. And did you know you can use them to pay for your dental care as well? HSAs can be used to pay for routine checkups and cleanings, fillings, extractions, braces for your kids, dentures, x-rays, and surgeries. But not everything is covered by your HSA. According to eHealth, most teeth whitening procedures are not covered by your HSA. Same goes for most cosmetic procedures such as veneers. You also can't use your HSA money to pay for toothbrushes and mouthwash and over-the-counter whitening products. And if you receive dental care overseas, chances are you can't use your HSA money to pay for that. A big reason why people don't stay up to date on cleanings and checkups is appointments can be expensive if you don't have an insurance plan. One affordable option, get your cleanings done at your local dental school. Nicole Kahn discovered patients who get their dental work done at a local college saved a lot of money.
Henry Smith's smile says it all.
I found paradise. This is paradise for me.
Not many people say that about a trip to the dentist. A decade ago, Smith ditched his regular dentist for the UT Health San Antonio School of Dentistry and hasn't been back. Initially, it was the cost of care that converted him.
To get my teeth back in Class A condition, it was 5 figures, not low 5 figures, it was high 5 figures. And of course, I told him I couldn't afford it.
The savings and quality of care has Smith showing off his smirk. Dental students care for patients under the close supervision of teachers.
The savings for the actual care is going to range from 20 to 60%, depending on the nature of the procedure.
Not ready to switch dentists? Look at buying your own dental insurance. The smart shopping expert, Andrea Warrock.
You pay a smaller annual fee, and then that will definitely dramatically reduce the cost of some of those more expensive dental care services. You can even go to a warehouse club store like Costco. They sell dental insurance.
Or see if you can set up a payment plan, especially before a big procedure.
You maybe pay over consecutive months, and then you don't have to pay that credit card interest.
Plus, find deals for dental work on Groupon or Living Social.
Oftentimes, the deals are for things like teeth whitening, maybe even straightening or cleaning services. Maybe you have to buy a bundle package, but you get a 30 or 50% discount off the deal.
Giving you a great grin for less.
So a lot of great options out there to save some money. A great way to get started is a quick internet search. Just type in something like dental programs and the name of your hometown or state and see what comes up. You may find an affordable option that you never knew about. Well, one reason trips to the dentist are becoming more expensive is the people who clean your teeth. In many areas, wages for dentists and hygienists are going up to keep up with inflation and to stay competitive. The American Dental Association says there is a shortage of dental hygienists and dental assistants, with 1 in 3 dentists struggling to fill openings at their practice. Jennifer Hoff has the story.
So any questions or concerns about your teeth or your gums today?
At Tonka Smiles in the West Metro,
So we're almost done measuring here.
Lolly Williams is a longtime hygienist,
I do love what I do. I need you some water.
seeing sometimes up to 60 new patients every month.
I have, other colleagues where they work in various parts of the cities and they're booked out 6 months.
Impacting wait times even more is a growing shortage of hygienists. In fact, the American Dental Association reports a third of all dentists are struggling to fill those positions.
We did not really see it to the degree it is until lately.
The Minnesota Dental Hygienists Association's Gene Anderson says a poor workplace culture, burnout, and low pay is part of the problem attributed to the pandemic.
And today I think there are many other choices for women besides dental hygiene or nursing.
Except enrollment is up at the state's 9 accredited programs.
All right, I'll give you a witness here, Amy.
Only the lack of clinical space is limiting the number of students.
The interest is very high. They're just not able to take the numbers of students that they could be taking.
For some people, barriers already exist to access dental care.
So far, everything looks nice and good.
These experts worry this sustained shortage will only make it worse.
With different demographics in rural areas, it is a lot harder. And some people will have to travel 2-3 hours to a clinic just to be seen.
The American Dental Association says many dentists are adapting to this shortage by changing their hours. So the next time you schedule a cleaning, you may notice fewer options to set up an appointment. But the association says they have several initiatives that they're working on to hopefully inspire more people to pursue a career in dentistry. Let's move into the numbers. The cost to keep your teeth healthy and clean. According to Humana, without insurance, a basic cleaning and polish will cost you anywhere from $75 to $200. X-rays will cost anywhere from $100 to $200. Fillings can cost as little as $50 all the way up to $4,500 if you splurge on a gold filling. Crowns will cost you anywhere from $500 to $2,000, and a root canal, expect to pay between $500 and $1,500, depending on the type of tooth you're working on. Lots of fun stuff, right? Well, coming up after the break, dental care in retirement. There's no Medicare for your teeth, so dentists recommend getting that work done before you retire. After the break, I sit down with a dentist who explains how we can all save money on dental work in retirement. Stay tuned to Your Money. Well, people talk a lot about health expenses and planning for health insurance and major medical bills, but you might not think about planning for dental procedures. And to help us get a good plan in place and start to think about some of the procedures that could cost us money down the road, I've invited Dr. Rose Perpich to come into the studio. You're with Stillwater Family Dental. Thank you so much for coming on the show.
Oh, thank you for having me. Actually, working with older adults is my passion, so I'm happy to talk about it.
So do you feel like a lot of people maybe are surprised about some of the expenses that come from some of these major dental procedures and maybe don't necessarily plan for them when they're in their 50s, 60s or retirement?
Absolutely. I think a lot of people aren't aware that Medicare does not cover dental, and you can buy supplemental dental through Medicare, but you really have to look at the cost benefit, how much it covers, how much it's going to cost. So I always encourage people to talk to their dentist, if they're looking at plans and planning for retirement.
So I bet advice would be to get as much done while you're still with your employer's insurance, right?
Yes, and when you're working and busy, sometimes it's hard to fit in taking care of yourself, but it's really important to not put it off as things get worse, and then right before you go to retire, it's like, I always say, it's like if you don't exercise for 5 years, it's going to take a little while to get healthy again. So you don't want to skip the dentist for 5-10 years and then decide to retire and have a lot of expense.
And on this show, we talk a lot about retirement planning, and one thing that we really try to encourage our viewers to do is to think about what their retirement is going to look like. What are their goals? What do they want to do? If you want to maintain the same lifestyle that you have now, you have to save a certain way. But if you want to do a lot of extra traveling, you have to save a little bit more. But I feel like when we think about dental, people maybe don't have that in mind when it comes to their retirement planning. But that can be, tens of thousands of dollars in retirement as well.
Absolutely, and HSAs are a good way to save for your retirement, of course. And I think there's a little bit of a myth. People think that children get cavities or you have problems when you're younger. And actually, as we age, your health declines, maybe diabetes, heart issues, and that affects your oral health and it affects your heart health. So things like dry mouth are very common as you get older. And so you actually can have a lot more dental issues as you get older and as your health declines.
And I was going to ask about HSAs, making sure that you can use HSAs for dental procedures and things like that, right?
Absolutely.
What are there types of, you said dry mouth medications, things like that. Are those mostly covered under HSAs as well for dental? It's not just the procedures that you can kind of reimburse yourself, but a lot of the medications and crowns and things like that. Can you?
Absolutely. And as far as dry mouth and things like that, there's products over the counter. You can use extra fluoride. As you get older, your dexterity declines, maybe an electric toothbrush, things like that to help yourself stay more healthy. But yes, the HSA can cover any dental procedure.
What would you say are some of the most expensive procedures that might surprise people, like that take a lot of work and a lot of effort to do?
I think depending upon your income, even having your teeth cleaned and x-rays is expensive. So we usually do a full set of x-rays every 5 years. So making sure you get that done when you're still working, and at least that gets you through the next 5 years, or, besides some periodic things. If you lose a tooth, that's generally the most expensive. So, and it ranges in how you can replace that from something that comes out or an implant, which is, the best replacement, but the most expensive.
For sure. So implants, I know, crowns, cracked teeth, things like that. Those things, those happen regardless of your age. But do we start to see some more of those stuff as you get into your 70s, 80s, 90s?
Absolutely. And like I said, with that dry mouth, a lot more cavities, because that's your natural body's way of helping to clean and protect your mouth. And when you don't have it, it can really, really be pretty rampant and go quickly.
And I know everyone is so different. I mean, there's some people that maybe had 10 cavities as a kid, someone had no cavities. Some people never have to go to the dentist. Some people are there every couple months. But when you're starting to try to plan for what that expense could look like in retirement, what would people kind of be planning for? I mean, a couple thousand extra dollars, or how do you even budget for something like that?
I think you just brought that up. I think everyone is different. So if you've had a lot of issues, it's probably not going to change as your health changes as you get older. And talk to your dentist. Have a good communication with them and say, I'm planning to retire in a few years. Do you see things? What do you see maybe needing to be updated or replaced, or something that looks like it's, at risk of breaking? Those are the questions to ask.
You talked about insurance and how there are these options in retirement. Based on what you've kind of heard from your clients and doing, your research, is that beneficial? Does that type of insurance save people money, or is it something that it's so expensive that you're better off not doing it?
You really just have to, again, either ask your dentist, or their front desk usually are experts on insurance, but finding out what the cost is and what they cover. And they can help you look at those numbers, because if what you're paying is only covering one cleaning a year, maybe it's not worth purchasing. And of course, the more you spend, the more they'll cover. And so it's just good to ask those questions and ask those experts at the front desk, because they really know the specifics on insurance and what they cover.
And I know I've heard that some health professionals in some settings will offer their clients discounts if they do it out of cash and not do insurance, because it's an easier process for the professionals. Do some dentists offer things like that, or discounts, if they just pay out of pocket or with cash?
Yes, a lot of dentists have either in-house savings plans, so then you get a discount like if you had insurance. Also, if it's a cash, they may do a 5% discount or something. So a lot of offices do offer those things as well.
For sure. I want to go back to HSAs, because this was something that I actually recently started doing, because my wife and I were just looking at our finances and everything, and we have 3 kids, and we were like, you're going to be spending that money at some point if you're putting it on health expenses. So we just decided to put more money into the HSA. You kind of get the tax break, right away, and that money can grow. It might be a good idea for someone. You don't have to necessarily earmark it for dental, but with some of the extra costs for health in retirement, starting now, if you're in your 20s, 30s, and 40s, put money into that HSA might be a good idea.
Absolutely, and I know some HSAs you can invest, so you gain more from that money versus a savings account. Also, some employers match some of those HSA funds, so I think I do that personally. I save in my HSA, because I know paying for insurance and all of that when I retire is going to be costly.
Yeah, and people, you think of your 401k as a retirement account, but your HSA can be a retirement account because, like I was saying before, you're going to have those medical bills and expenses at some point. And here you're getting the tax break going in, and as long as you're using it for dental or health, you don't pay taxes on it later on. So it is kind of a way of retiring, a retirement account.
Absolutely, absolutely.
And so what are some other saving strategies or advice that, you've picked up talking with clients who are retired and trying to navigate these costs?
I think, again, having a good communication with your dentist to try and plan ahead, or, again, using the benefits when you're working so you're not having a lot of issues when you retire, so you're not behind on taking care of yourself. I think that's the biggest tip.
Because I'm sure a lot of these problems as a dentist, you see them coming. You're like working with a client, you're looking at their teeth, their gums, and you can kind of say like, this isn't a problem now, but maybe 5 years down the road. And if you have that knowledge, you can kind of plan for that stuff, right?
Yes, and dental disease doesn't go away. It sadly just gets worse. It doesn't heal like a common cold. So yeah, catching things early is always a very big cost savings.
For sure. But like you said before we started recording, if you're going to get in before you retire, don't wait till the last week.
Yes, I've had that happen. I'm retiring next month, and I'd say, oh, congratulations.
Give me the whole workup. I got 1 week, and you're like, okay.
Yeah, exactly. So planning ahead, of course. Yeah.
For sure. Well, thank you so much for coming and giving us some great things to think about.
All right, thanks for having me.
After the break, mercury in tooth fillings, is it safe? Our Verify team looks into it. Plus, dental care for your pets. Why vets say keeping your pet's teeth clean can save you a lot of money on vet bills. These stories and more coming up after the break. Welcome back. Thank you for staying with us here on Your Money. We are staying with this theme of protecting our teeth and saving money. There are different types of fillings that you can use to fill your teeth, and one of those options contains mercury, which was concerning for a few people. Our National Verify team looked into whether these mercury fillings are actually safe.
When you have a cavity, you end up at the dentist, getting a filling to repair the damage to your tooth. You often have two options: a tooth-colored composite filling or a silver-colored dental amalgam. According to the FDA, dental amalgam fillings contain liquid mercury. A viewer texted us to ask if dental fillings that contain mercury are harmful. So let's verify. Our sources are the U.S. Food and Drug Administration, the Environmental Protection Agency, the American Dental Association, and Dr. Kelly Johnson Arbor, co-medical director of the National Capital Poison Center. The answer to this question needs context. Here's why. The type of mercury used in amalgam fillings is called elemental or liquid mercury. It binds together with other ingredients in the filling, and once it's applied on your tooth, it hardens into a stable substance. The danger comes from the process of installing or removing one of these fillings, which can expose people to mercury vapor. When dentists drill the amalgam, the friction generates heat, and that heat allows mercury in the filling to escape into the air as a vapor.
Because it's toxic through inhalation, if you breathe in those fumes, that's what can be dangerous.
Both the FDA and the EPA say the amount of mercury that people are exposed to when they get dental amalgam fillings is generally considered safe for most adults and children over the age of 6. But our sources say certain people should avoid getting these fillings, including people who are pregnant or planning to become pregnant, nursing, or those with kidney issues. So what should you do if you already have a dental amalgam filling like this one? Just leave it there. The FDA says removing intact amalgam fillings results in unnecessary loss of healthy tooth structure and exposes you to temporary increase in mercury vapor released during the removal process.
But if you are still worried, you can always get a composite filling. You have options. Just talk to your dentist about your concerns, and they will tell you what options they have available. All right, so we talked a lot about the importance of dental hygiene for you and your family, but what about your pets? Veterinarians say keeping your pet's teeth clean can also save you money on bigger problems later on. Aaron Walker stopped by a vet clinic to see why dental care for your pets is so important.
Smile. Pets should not have bad breath, just like humans should not have bad breath.
Dr. Tiffany Menke is a veterinary dentist at CVets in Columbia. She says that from smelly breath to more serious conditions, dental care is important for our pets' overall well-being.
Just like in humans, we know that periodontal disease can affect the heart, the liver, and the kidneys.
Brushing your pet's teeth daily is one of the most effective ways to prevent plaque and tartar buildup. Use a pet-specific toothbrush and toothpaste.
So you want to use a small-headed, soft bristled toothbrush, just like a pediatric toothbrush. And you want to use that kind of circular motion along the gum line so that you're brushing away the plaque. And you want to use an enzymatic toothpaste. And you want to kind of get all the way into the back as far as you can.
Additionally, Dr. Menke says some pets may prefer an oral hygiene rinse or edible diets that help prevent plaque accumulation.
I know, based on my own experience, cleaning those teeth on your pets can be a hassle. But just think about those vet bills. A little extra work now could potentially save you thousands of dollars down the road. It's amazing. One of the smallest parts of our body, our teeth, can lead to so many problems for our health and our wallets. It may be easy to just ignore these problems and hope they go away on their own, but chances are you're setting yourself up for even bigger problems down the road. If you don't have dental insurance, consider a special savings account just for your health and dental expenses. If you invest that money into safe investments like a money market fund or a high-yield savings account, you can offset some of these costs. For example, if you set aside $1,000 a year and you're making 5% on your money, that's $50 a year. In some cases, that may come close to covering the cost of an annual checkup. Plus, you still have that $1,000 that you can use to get started with your savings for next year. On that positive note, we're going to wrap up this dental care episode of Your Money. I'm Gordon Severson, helping you save, spend, and invest your money wisely. I'll see you next time.